Okay, this is a short summary on the gallbladder and bile ducts for year 3 medical students. Okay, history taking and examination is a very important aspect of year 3 training. First of all, you must obtain the chief complaint or complaints as the case may be. Then you go into the details of these complaints in the history of present illness. Each details of each symptom, positive and relative negative symptoms. Go to the relevant medical and surgical history, including family and social history. Then from there we come to the physical examination. Okay, a detailed examination, the general examination of the patient, followed by a local or specific examination of the patient. Then you go into the details of the positive and relative negative signs. From this you come to a clinical diagnosis. Okay, which consists of a provisional diagnosis and a couple of differential diagnoses. So once you come to diagnosis, then you go into the rest of the investigation and management. Okay, now what are the diseases, common diseases of the biliary system? First, the common one is this related to gallbladder problems, cholelithiasis, biliary colic, acute cholecystitis, chronic cholecystitis. These are the common conditions. And these are the complications of cholecystitis: empyema, gangrene and perforation, and the other diseases involve gallbladder polyps or carcinoma of the gallbladder. And as far as the biliary ducts are concerned, the three important or common diseases will be cholelithiasis, cholangitis, and stricture of the CVD. Less common, sclerosing cholangitis, carcinoma head of pancreas, cholangiocarcinoma, and periampullary carcinoma, which all cause obstructive jaundice. Then you have some congenital conditions in children, biliary atresia and choledochal cyst. Now, what are the symptoms of gallbladder and biliary disease? First, you've got the specific symptoms, symptoms related specifically to the gallbladder and bile ducts. These include pain in the right hypochondrium, fatty foot, aggravated by fatty foot, radiation to the back or the right shoulder. Sometimes patient has got complaints of breathless, and radiation of the pain to the shoulder and the back, as I mentioned. The onset is usually acute in onset, usually within a few days. Sometimes they can be jaundiced, decolored urine, pruritus, and clay-colored stools, suggestive of obstructive jaundice. And if it's some form of infection like empyema or cholangitis, they can have high fever with chills and pruritus. The second group of symptoms, which I call non-specific, include nausea and vomiting, fever, loss of appetite, diarrhea, lethargy, and generally the feeling of unwellness. Okay, I call this non-specific because any abdominal conditions can come with these symptoms. Now, what are the signs of gallbladder and biliary disease? Okay, these are the list of common signs that you must look for in the patients with bile duct and biliary disease: jaundice, fever, tenderness, guarding and rebound tenderness, especially in the right upper quadrant of the abdomen, positive Murphy sign, a palpable gallbladder in accordance with the Courvoisier's law, and hepatomegaly. Okay, the three important group of syndromes which must be recognized will be the Charcot's triad, which is due to cholangitis, consists of three things: pain, fever, and jaundice. Then Reynolds pentat, Charcot's triad plus two other conditions known as hypotension, and mental disorientation, which are more severe forms of cholangitis and leading to shock and sepsis. And then you have the Courvoisier's law, which is related to a palpable gallbladder and obstructive jaundice. And in this condition, it's unlikely to be a gallstone as the cause of the obstruction. Lastly, the important conditions and diseases of the bile duct and biliary system. Gallstone-related causes account for 80% of the conditions. These include biliary colic, acute cholecystitis and its complications, chronic cholecystitis and complications, obstructive jaundice due to choledocholithiasis, and malignancies, which we call the triple cancer of obstructive jaundice. And lastly, cholecystectomy, laparoscopic and open, the indications and complications of this procedure. So these are the important conditions that you must be familiar with during your posting in surgery. Thank you for your patience.